Hi, my name's Kelly. I'm a CBT therapist and forensic psychologist, and today I wanted to talk through one of the models that underpins a lot of the treatment that we use within forensic psychology. So it's the Good Lives model, which was first suggested by Walden Stewart in 2003. And really before this, much of the focus was how can we reduce offending behaviour or offending any sort of crimes that an individual has committed. How can we stop them doing that again? And in doing so, is often overlooking that their idea of the truth that recidivism may actually be further reduced through helping individuals to live better lives and not simply targeting those isolated risk factors that either led to them committing crimes or offending in the first place. And this was quite a shift, really, from thinking about, okay, let's just not target on those risk factors. Let's actually focus on what could give someone a good life, hence the Good Lives model. And when looking at it, it's really effective to be able to help someone to reduce their risk and to give individuals the necessary conditions to lead them to live a better life, so a good life. And it doesn't actually just teach them to minimise their chances of being put in prison. And within the Good Lives model, the primary treatment should be able to give an individual the necessary skills or capabilities to ensure their being able to achieve those important personal and social goods, as they called it, in acceptable ways. Obviously, in addition to reducing and managing their risk. So within the model, they focused on a variety of areas that an individual would want to achieve. And the interesting thing is that throughout an individual's life, their needs will often be the same, but it's how that they achieve those needs that may lead them to engage in criminal activity. So, for example, it could be that one of the needs is pleasure. So that could be about feeling good and being in the here and now. But an individual may engage in offending behaviour to achieve that good. So achieving offending to get pleasure rather than maybe looking at other ways that are more pro-social that would allow someone to feel good and be in the here and now. So as I said, there are a range of goods and I'll talk through them. And just think about that individuals who engage in criminal behaviour will be looking at these goods and wanting to achieve them, and that doesn't often change. But it is actually the motive of how they achieve those goods that does change. So, as I suggested, some of the goods that an individual would want to achieve in their life is simply life. So having healthy living and functioning, inner peace, so having freedom from emotional turmoil and stress, excellence in play, so looking at hobbies and interests, spirituality, so this is in the broad sense of finding meaning and purpose in life. As I mentioned, pleasure, so that feeling good and being in the here and now. And knowledge, so how well informed one is. Creativity, so being able to express themselves through kind of different forms. Community, so feeling a connection to a wider social group. Excellence in agency, so that's feeling autonomous, feeling powerful, and feeling knowing where they're being quite self-directed. Excellence in work, so this thing kind of including being able to master certain experiences or certain skills, and then relatedness. So this is when this can include intimate and romantic relationships or familial relationships. So all of those different needs and goods are present in most of us. And think about those ones that I just went through. What are the ones that are most important for you? What are your top 4 needs? And remember, as I said, we all have them, but someone who engages in offending behaviour, they'll be trying to meet those needs, but they'll just be doing it through crime. And that is where the Good Lives model comes from, understanding what an individual wants, what are their needs, what's important to them, and giving them the skills and the capabilities to enable them to do that in a pro-social way, so a way that doesn't include crime. So that's why it's something that is really, really important when we are thinking about working with people. So let me give you an example. So if we was to take someone's top 4 needs as the kind of the friendships, relationships, community, and excellence. So the activities that they may have engaged in those when they were offending could be drug abuse and maybe internet offending, for example, maybe holding images or acquiring images that were illegal. And because of that, then they may be relating to other criminals and victims. So they are meeting those needs and desires, but in a way that is antisocial, it's illegal, and it's criminal. But if we look at those same needs and desires of friendships, relationships, community, and excellence, and then thinking about, okay, so what activities or preoccupations could someone engage with to meet them? So it maybe could be about having satisfying employment and maybe playing football at the weekends. And so they're able to relate to maybe other non-offenders. They're able to maybe develop appropriate partnerships. But they're still achieving their needs and desires exactly the same, but they're just achieving it a different way. So that is a real micro, tiny piece of the puzzle. But it is just something that is really important. I wanted to share that when we're looking at treatment, when we're working with offenders, the Good Lives model is really helpful. And even if you think about yourself, think about the things, what are your needs? What are the most important goods to you, so the goods are the needs, and then think about how do you achieve them, and think about are there any other ways that you could achieve them. And it's exactly the same in the treatment. We're just looking at offending behaviour to non-offending behaviour. So I hope it gives that bit of an insight into the treatment of people who engage in offending behaviour, and I hope you found that helpful. And please make sure to check out and like and subscribe my videos. Thank you and take care.